So we were very interested not only in how obesity can increase the growth of cancers, but also whether it can cause cancer. So this is an area that's still quite underdeveloped. And we were especially interested in a population of women who are at high risk of developing breast cancer. So women who have hereditary cancer syndromes, such as those who carry mutations in BRCA1 or BRCA2. These women are at high risk of developing both breast and ovarian cancer in their lifetime. And it's still unknown whether lifestyle or environmental factors can modify the risk of cancer in these women. So we set out to see whether the obese microenvironment of the breast, for example, as well as systemic factors might be able to cause changes to the normal epithelial cells of the breast that could lead to the development of cancer eventually. What we found was that the obese adipose tissue actually has the capacity to cause DNA damage in normal epithelial cells of BRCA1 and BRCA2 mutation carriers. And this DNA damage has been suspected to be one of the first steps in tumor formation. So these findings were quite interesting. They were, for the first time, really showing that obesity and a modifiable risk factor could have an impact on the development of cancer in these women. In addition to that, we identified several factors that might be drivers of this effect, including steroid hormones like estrogen. And we find that if we can reverse or if we can decrease the amount of estrogen, we're able to decrease that DNA damage. We then pursued additional preclinical studies in a mouse model where we had a very controlled setting. In this case, BRCA1 heterozygous mice that were placed on a high-fat or a low-fat diet had different amounts of damage as well. So similar to what we were seeing in clinical samples, whereby a high-fat diet really stimulated the amount of damage in the tissue. And we also saw an increased mammary cancer penetrance in this model. Again, all of this suggesting that obesity, a modifiable risk factor, might be contributing to the development of breast cancer in these women.